Hello, I'm Maheshwari Senthil. I'm the PI of UCI Biospecimen Repository Protocol. I'm glad you're interested in contributing to this protocol as a sub-investigator. The Biospecimen Repository Protocol is an IRB-approved study which is being conducted in collaboration with the Center for Clinical Research, Institute of Clinical and Translational Science, as well as the Experimental Tissue Resource Center. It is entirely funded by the School of Medicine. Any patient who is receiving treatment at UCI is eligible to participate in this protocol. Legally authorized representatives also may provide consent for patients with serious life-threatening conditions or diseases who otherwise lack capacity for consent. Participation in the UCI biospecimen protocol allows for longitudinal prospective biosample collection along with clinical annotation during clinically relevant time points chosen by the physician, namely the sub-investigator. The samples are collected, processed, and stored as per stringent protocols. And samples are typically collected during standard of care encounters. However, if needed, research-directed blood sample collections are allowed. The type of samples that are collected through this protocol include blood, urine, and saliva. In addition to that, tissue samples, ascitic fluid or peritoneal lavage samples, or pleural fluid samples could be collected during standard of care procedures. Here is the biospecimen team. Annabelle Doe and Siddhant Pratap are both clinical research coordinators, and Peter Horvath is a project specialist with the ICTS. Now, how do sub-investigators get involved? If you're interested to become a sub-investigator, you're expected to complete a city training for human subject research and undergo a 15-minute protocol-specific training session, and then start enrolling patients into the protocol. It's very simple and straightforward. And through this video, we will introduce you to that 15-minute protocol-specific training. The biospecimen process consists of investigator presenting the study to the patient. And if the patient agrees to participate in the study, the investigator then obtains an electronic consent as well as documents the consent process in the patient's progress note. After this, the investigator sends a message to the biospecimen team and places the order for specimen collection. With that, the role of investigator is completed. The biospecimen team then enrolls the patient into the ENCORE clinical trial management system, collects the basic clinical information, and coordinates sample collection. The samples are brought to the ICTS storage site in Orange Building 55. They are processed and stored for future research. The samples will have unique biospecimen identification number, and they are linked to the patient information in the clinical trial management system, and samples will be stored till depleted. Let's go ahead and start the training process for this biospecimen protocol. There are 4 key steps. One is obtaining the electronic consent. Second is documenting the consent process in the progress note, messaging the biospecimen team indicating that a consent has been obtained for that specific patient, and then subsequently place orders for sample collection. And the samples could be collected either during a surgical procedure or an interventional procedure or as an outpatient. And we will show how to place orders for either one of those type of encounters. Let's start with the consent process. In the patient's EPIC encounter, investigator will access the consent tab. The consent tab could either be located in your banner bar, or if you're not seeing it in the banner bar, you can go to the arrow to the right side of the screen, and when you hit the arrow in the drop-down box, you would find the consents tab. And once you press the consents tab, you will then be able to choose the research consent. And the type of research consent is the UCI biospecimen repository. So when the research study pops up, you will be able to select the UCI biospecimen repository as the research consent that you want to consent the patient for. And once you have selected this, the consent opens up. And it is really important for the investigator to go through the nature and the purpose of the study, inform the patient of any side effects, procedures from the study. And this is a minimal risk study. Apart from blood collection, there's really not much invasive part to the research study because most of it is all standard of care. The benefits, the risks, and cost associated with the study should also be explained. There is no cost to the patient. The participation is entirely voluntary, and the patient can refuse or dissent participation at any point during the study. So all of this should be explained, and then you can proceed with asking the patient to sign the consent. I want to highlight an important part. For patients who are non-English speaking, they must be present at the consent in their preferred language. The typical languages for which we have translated consents are Spanish, Korean, and Mandarin. And these electronic consents will become available in the next few months. Until then, please refrain from consenting patients who are non-English speaking and just consent English-speaking patients for now. Once you have explained the consent, then you will proceed to the signature part of the consent. And the patient will sign in the bar that is assigned for them. And as an investigator, you will sign in the staff portion. Now, after completing the research consent, you should also proceed with completion of the HIPAA part of the consent. And here you could ask the patient if they allow permission to certain specific information. And there are 4 areas listed here. And you can go through each one of them and make sure the patient is either willing or unwilling to allow access to this information. And then there is also the optional research activity. I highly suggest talking to the patient about this because this is an important piece of information for future research purposes to access their clinical data. And once the patient has chosen to provide access to their clinical information, the patient will go ahead and sign the patient portion of the consent. There is no staff signature required for the HIPAA portion. So the staff, as the sub-investigator, you only have to sign once, but the patient has 2 areas of signature. One is the consent portion, the other one is the HIPAA portion. And it's really important to complete the HIPAA portion of the study for us to be able to access the clinical information of the patient. Otherwise, the consent is invalid. And hence, double check the consent as well as HIPAA have been filled out to completion. And once this has been completed, you can go ahead and accept the consent, which will now be available in the patient's electronic medical record. After you have completed the consent process, there are 2 very important steps that needs to be done. You will have to message the biospecimen team by using the new messaging box, and you can select the UCI CCR biospecimen repository tome. It's a pool message, and you can indicate that you have consented the patient. Either the samples will be collected in an upcoming surgery or a procedure or as an outpatient. Either ways, you can indicate your intent for collection. And this is the way that the biospecimen team will be notified that a consent has been conducted. Otherwise, there's no other way for the biospecimen team to know that you have consented a patient into the protocol. Hence, this is a very important step. And then, according to research compliance, the investigator is expected to document in the progress note that they have consented this patient for the protocol. And it's very simple. At the end of your progress note, or you could create a separate progress note for the purposes of just this consent. You decide based on what you're doing with the patient that day. And it is a smart phrase, .ccr consent. And this will bring down this information, and you can just add this to the progress note. And this indicates that you have completed the consent as per the research requirements. This completes the consent part of the study, and now we will go ahead to the order placement. So the consent consists of completing the consent, the HIPAA portions of the consent, ensuring that the consent has been completed properly, and then informing the biospecimen team through messaging them, as well as documenting in your progress note or interdisciplinary notes that you have completed the consent. So those are the 3 steps associated with performing the consent. The final 4th step is placing the orders for the biospecimen collection. Now, there are 2 encounters during which biospecimens can be collected, either during a surgery or a procedure such as an endoscopy, or as an outpatient subsequently at a later time. We will go through the surgery or procedural related order or specimen collection, and then I will explain the outpatient orders as well. So if you're going to collect the samples at the time of a procedure or surgery, in that encounter, you will go ahead and place an order and you will choose Research Central Labs. And once you have placed the Research Central Labs, then this will show up and you can choose Nurse MD Collect, of course, because the specimens are now going to be collected by your team or yourself. And you can indicate in the comment box your intention as to what you're planning to collect. Is it 2 EDTA tubes of blood or 50 ml of urine? It could be any number of different things, and you can state as to what your intent is during the surgery at what type of samples you will be collecting. And once you accept this, there are two associations that you would have to do when you're completing these orders. One is indicating that this Research Central Labs or research association, and this is where the association would happen. You can go to the options and associate it to research, and you can choose the UCI Irvine Biospecimen Repository as a research association and accept that. And then the diagnostic association, indicating that this patient is a research subject. So you can go to the diagnosis association, select the research subject, and then place the order. It's very simple. It's usually, you're so well versed in your workflow in order placement. It's just merely going through it and just making that couple of research associations are made, that it is a UCI biospecimen repository study and the patient's diagnosis association is a research subject. Now we will switch to placing orders as an outpatient. And this is one thing that we have done really well with the biospecimen repository is ensuring that there is an integration with the standard of care lab orders and the research collection as well. So if you're seeing a patient in an outpatient setting and you have placed orders for standard of care blood draws, it could be a CBC or a chemistry or even a tumor marker levels. At that time, you can choose to also order research specific labs. So in here in the order section, you will just choose repository and the biospecimen repository lab orders would pop up. You can select that, after which you can make the diagnosis association, and that's all is needed, is because there's only one study that has this outpatient lab orders, and choose the research subject and you can go ahead and place the orders. When the lab technician at a future time point, when they're collecting the standard of care lab orders, they will be able to see that you have also placed an order for biospecimen, and they will be able to collect these samples. And on the back end, we have created a workflow in which these samples will be then brought to ICTS for processing and storage. You can choose to send a message to the biospecimen team if you wish at this point, but however, this is a very streamlined workflow and the orders come directly to the biospecimen team through the lab courier. It's always a good idea to inform the biospecimen team so they are aware of your intent to collect an outpatient labs. If you feel that's not onerous to you, I would highly recommend anytime you're placing an order to also send a quick message to the biospecimen team using the same methodology I had shown below. And so that completes your training. Again, to emphasize, the training consists of consent, informing the biospecimen team of the consent, as well as documenting your consent in the progress notes, and then finally placing an order either at the time of surgery or procedure or as an outpatient. If you have any questions, we are always available to address your questions. Once again, here is a team, and any one of the team member could be contacted to address any of your questions. Once again, I thank you for your interest in becoming a sub-investigator for the biospecimen repository. We are eager to work with you and help you be very successful in enrolling patients to this protocol. Thanks again.